Good morning. My name is Jo Jacobson. I'm the CEO here at San Joaquin Valley Rehabilitation Hospital. I am also a physical therapist by background. I was asked today to speak on our neurorehabilitation program. And when you think about the word neurorehabilitation, you really want to be thinking about the brain and the spinal cord and all of the nerves and operations that these two incredibly amazing organs do for our body. So first of all, let's talk a little bit about where we see patients coming from with that neurological diagnosis. These are issues, as I mentioned, with the brain and the spine. We could be talking about a stroke, a brain injury, a spinal cord injury. These could be traumatic from an accident or an insult, or they could be non-traumatic. They could come from a virus, such as Guillain-Barré or meningitis. We also in our area see valley fever that at times can impact the spinal cord or the brain. A significant lengthy illness with an elevated temperature can also have an impact to the brain. Post-surgical, at times, under the best circumstances, there could be issues that result in an infarct or an impact to the brain or the spinal cord. Essentially, at a rehabilitation hospital, what we do is we will meet the patient out in the acute care setting and assess their impairments and look for the need for intense rehabilitation and for that medical supervision and the 2 disciplines of therapy minimum that would be required. Often it's 3. Often we're seeing folks that have impairments needing physical, occupational, and speech therapy, along with the rehabilitative nursing and education that we do, nutrition, psychosocial needs. We would be educating and addressing impairments in mobility and working on daily living and self-care skills. Here we'll be addressing the ability to eat as well as swallow, any speech needs, looking at their nutrition. We look at and address safety, lifestyle changes that may have to occur. And obviously with these types of significant injuries, we're looking at the psychosocial needs as well. So again, when you think about neurological rehabilitation, the place for a patient is going to be in that team environment of an acute rehabilitation hospital overseen by a medical and physical rehabilitation physician. And the care that we provide is second to none. Rehabilitation hospitals across the country are experts in neurological rehabilitation and in the neurological patient. Thank you so much for listening today. I hope you learned something new.